We'd like now to call on the next speaker, Dr. Anil Gangwe, who's going to talk about how to become an ROP screener, tracing the trail of training.
So good morning everyone, and thank you Professor Azad and Dr. Anand Vinekar for this opportunity to present our experience on ROP screening. So the topic allotted is how to become a ROP screening, and I would go with this because most of us would begin as a student or as a senior resident, as a fellow, and before we actually start doing ROP screening, as it is done with us, that it is told in MBBS that before knowing the disease itself, we must know the normal process or physiology. If it is very well understood by you, you will easily pick up the disease. So before that, we must understand the embryogenesis or retinal vascularization, and what is the role of oxygen or the pathophysiology of disease, and how actually VEGF is acting in both the ways, why it is responsible for physiological angiogenesis as well as the way it goes wrong, it can cause ROP. And we must practice indirect ophthalmoscopy in adults before we are actually planning for ROP screening, and get most important part is get a mentoring or training, at least if it is not possible for a long period point, but at least for if you are an VR fellow and have a good hands on indirect ophthalmoscopy, you can learn at least good ROP screening with a mentor in 4 to 6 weeks. And if you are a general ophthalmologist, it may take slightly longer time, but you will be able to pick up a treatable form of disease at least in 2 to 3 months. And if you are good enough in screening or indirect ophthalmoscope, lasering the ROP or managing ROP will be much easier for you. So once you are a trained person and now comfortable in screening, then next step will be to get an access to NICU or SNCUs. So for that, important thing that you will need to understand that the pediatricians where you are settling or you are going to practice, they should know you. So how they are going to know you, you will need to visit them repeatedly. You will have to show your presence in their local CMEs. You can attend the IM, Indian Academy of Pediatrics, or NNF CMEs, and if allowed, you should try and present some latest things about ROP which the pediatrician may not be aware about. Recent topics like anti-VEGF, where they are also concerned, you can talk about such topics, then they will start knowing. And as Professor Dogra was also talking on this, we should make the parents aware about what is ROP, directly landing their children and screening them. You should make things available in most of these NICUs, or you can distribute this pamphlet in the NICU discharges. And as sir was also saying, we are sticking these kind of stickings to the NICUs, where the pediatricians as well as the parents of the children, they are able to see this, so that it can give some idea what the baby must go through. And once you are into one SNCU or NICU, you must understand the team with which you are going to work. The team definitely constitutes of NICU nurses, the fellows, and the neonatologists, but nurses play very important role in ROP screening and the subsequent communication with the parents. So we must understand, and we must educate our team, understand them and educate them why or what is ROP, why the entire exercise is being done. And it has to be done not only on a theoretical ground, but you must give some emotional impact, what is their role and how much they can actually play important role in prevention of ROP. So that is very important. We must train them that what is their role, how they can help us to dilate. The process of examination need to be explained to the staff. And before after you have trained them, you must understand your own instrument, that okay, what all things you are going to do. And you are usually I would start that we should start with indirect ophthalmoscopy, and once you scale up, then you can actually start doing telescreening as well. And initially, first starting ROP screening, you will have to reassure yourself that you are not going to harm the baby, because as a student, or most of us are not parents when we are starting ROP screening. So you may not be very much comfortable in handling a small and such a small neonate. So be assured that you are not going to harm the child. be comfortable with the children, and once you are into that, before applying the speculum to the child's eye, you must know that what is the appropriate gestational age and corrected postmenstrual age. You must go inside with a certain thing that, okay, if there is no ROP, I would expect that, okay, around 37, I would be expecting a mature zone 2. And if there is ROP, okay, there might be stage 2 or stage 3 and may need treatment. You must go inside with a certain mental picture, and you will need to learn how to see the anterior segment without using a slit lamp. So you will need to practice this, and you will need to identify certain things like corneal haze, poorly dilating pupil, tunica vasculosa lentis, NVI. And once you learn this, then the next thing that you should focus on is, without applying any depressor, you should learn to identify and see the posterior pole, because if you learn this, then it is practically impossible that you would miss any treatable form of ROP, because most of the things can be picked up, not all, but most of the things can be picked up from the posterior pole and the morphology of vessel at that. Then know the zones, and of course theoretically we will know bit of it, and understand the process of scleral depressor. Irrespective of the instrument that you use, you will need to understand that there is difference in the adult and neonatal sclera. The rigidity is very minimal. You would not actually need to depress to get an indent or elevation, and you will need to use this as a tool for maneuvering the eye, and that to see on either side of the scleral depressor, because doing this or understanding this skill will be very much helpful in doing ROP laser, because if you cannot see on either side of your depressor, there are very high chances that you laser on either side of your hill and miss somewhere in between. So this is an important skill which will help you to laser also. And the next thing is, I think we should, or as a trainee, we should learn to distinguish between vascular or normal or avascular retina by color. And color may not be a good criteria, because the pigmentation may take time to reach the peripheral thing, but we should try and trace the blood vessel which are normal retinal vessel. And if you are able to trace them, then identifying the ora serrata, that becomes very toughest. Actually it is one of the toughest tasks to identify, because once you know how to identify the ora serrata in a preterm or a neonate, which is much posterior, which is much more anterior compared to adult, classification, the zoning, which will be much easier. And once you know what is normal retina, what is normal looking retinal vessel, then identification of the abnormal blood vessels, or that is ROP, which will be much more easier in the background of normal retina. So identification of ROP will be easier if you know normal retina, whether it is anteriorly located disease or it's a posteriorly located disease. Then of course with time and with your theoretical background, you will always know stages of the ROP, and as a beginner you should be able to identify at least first 2-3 stages. Next thing I think you will refer. Important and the most crucial part of ROP screening is, whatever you have seen, you have to communicate to the parents in the language that they understand. They must understand what is ROP and why you are going to treat that particular baby. So once you have done this, your journey will keep on going, and you will initially you would know the natural course of disease in terms of textbook, but if you want to really learn from yourself, you initially follow your babies closely. That you will understand how it progresses from stage 1 to stage 3, and you will be able to monitor the natural history of ROP by yourself. Document the findings with very good records, because you will learn from your own records, and never hesitate to question yourself. If you are coming across some abnormal findings which you are not aware, please do not hesitate to ask and go to your mentors and ask about what is it, I am not able to justify it. And the process of de-learning, initially that certain things that we were aware and that you are treating with laser monotherapy, you will be very hesitant to learn something new. So the process of de-learning and learning shall always continue. I think that's it. Thank you.
Thank you, Anil. That was extremely practical, like a Hutchison manual. and very, very useful. Thank you so much for those insights.